All right, ladies and gentlemen, we are talking about mental health. Specifically, remember the end goal is to write a one-page law that benefits people from a mental health care perspective because it's a terrible system, and it's just an awful problem, and we want to benefit that. Also, on a lighter note, I've got my super serious glasses. You can see these are super serious, super duper serious, because we're doing serious work, ladies and gentlemen. So this is an article by Bonterra. If I remember, I'll put this article in the whatchamacallit, the description. Put it in the description. But this is 5 barriers to mental health treatment and access to care. Once again, obviously, we want to help people not face bad things. First barrier, financial barriers to mental health treatment. Although Affordable Health Care Act requires medical insurers to provide coverage for behavioral and mental health care, the cost of treatment still limits access to mental health services. Mental health care services can be costly even with insurance or financial assistance. Copays and deductibles add up quickly when a diagnosis requires regular therapy, complicated medication management, or intensive treatment programs. For many individuals, a lack of financial resources prevents them from seeking help, leading to inconsistencies or inadequate treatment. A traditional 60-minute therapy session can range from $100 to $200 depending on the state. See, that's so expensive. A patient with major depression can spend an average of $836 a year on treatment. See, and the problem is money stresses us out. Money stresses us all out. And we can't have a financial barrier to mental health, or else more people are less likely to seek care. Number 2, lack of mental health care professionals and services. One of the main barriers to mental health treatment is a lack of available services caused by a combination of high demand for treatment and a low supply of trained professionals. The U.S. is facing an overall shortage of doctors, and the shortage of mental health professionals is steeper than any in the medical field. According to Health Resources and Services, 149 million Americans, nearly half of the U.S. population, live in federally designated mental health professional shortage areas. So once again, there's just not enough people to provide care. I would say, the only thing I really get is those, I get advertisements for mental health. What is it? That company, I guess they're going to get a shout out now, but BetterHelp, right? They do that telehealth services. But besides that, there's a shortage, I guess. Anyways, limited availability of mental health education and awareness. Another common barrier to mental health treatment is the general lack of mental health education and awareness. Those who have the greatest need for mental health treatment often haven't been taught about signs of mental illness and how treatment can help. And this is actually a really interesting point, because think about what we're taught in school. You're not taught. Mental health is just assumed that you're going to be fine with it and you're going to have it and it's going to be all peachy. But that, ladies and gentlemen, is not how life works. So in general, we just don't talk about it. So I guess we need to talk about it more. And that's almost the sake of my content in doing this, is to talk about it more, to reduce that stigma, which actually leads us to reason number 4. Social stigma of mental health treatment and condition. A person's own beliefs about mental health can prevent them from acknowledging their illness, seeking help, or sticking with treatment. Studies have found that the stigmas associated with mental health illness, defined as devaluing, disgracing, and disfavoring by the general public, often prevent people from accessing treatment. Oh my gosh, this is a true story. And this is probably, what's funny is this might be the biggest thing that's preventing people from talking about mental health care, preventing people from doing anything about mental health care, preventing a conversation from being started, is a stigma. Now, the bummer about that is that the stigma clearly exists, and so it makes stuff harder. My hair just got weird. But, the more we talk about it, the less of a stigma there is. And so I guess we just have to have more conversations in order to address that stigma and make it not such a big, scary thing. But rather make it a lot better. And last but not least, I didn't actually know about this reason at all, but number 5 is racial barriers to mental health care access and treatment. There are significant disparities in mental health care accessibility among different racial and ethnic groups. One survey finds that white adults, 23%, are more likely than black, 13.6%, and Hispanic, 12.9% adults, to seek and receive mental health treatment. In addition to the barriers discussed above, these disparities stem from the issues like a lack of diverse representation in mental health field, language barriers, and implicit biases from providers. According to the research from the American Psychological Association and the Bureau of Labor Statistics, 84% of psychologists, 67% of social workers, and 88% of mental health care counselors are white. People are less likely to seek help if they think their doctor can't understand or empathize with their background, cultural differences, and experiences. Now, I think in general, a law should make sure that nobody doesn't have access to treatment due to their race. But in terms of solving this problem, I don't know. It's an interesting problem to solve in that, America has a lot of white people, and to get people of different racial backgrounds, I don't know. That's a tough thing because they basically have to want to do the work. Anyways, this is my review of this article. I'll be posting this. And if you care about independent voters and you care about benefiting, right, like seeking more benefits for the people, then do my Patreon. You're going to get that call to action anyways right now. If you're an independent and you care about being represented, even more so if you're frustrated and you feel like you're not represented, the whole point of this project, the whole point of this content is to help independents feel like they've got a voice, feel like they've got somebody fighting for them. And so that's what this content's about. If you're interested in supporting this, go to the patreon.com/MiyakeZilla Patreon page and consider supporting us for $2 a month. That's all. All right, thank you very much. Bye.